In this presentation, we'll review the intricate anatomy of the skull. Knowledge of this anatomy will be essential to appropriately position the skull radiographically later. The skull rests on the superior aspect of the vertebral column and is composed of 22 separate bones divided into two groups. There are 8 cranial bones and 14 facial bones. The cranial bones can further be divided into bones of the calvaria, which are superior, and the floor, which are inferior. Together, they form a protective housing for the brain. The facial bones, which are separate, provide structure, shape, and support for the face. They also form a protective housing for the upper ends of the respiratory and digestive tracts, and with several of the cranial bones, form the orbital sockets for protection of the organs of sight. Let's take a look at the different bones of the skull in different views. These should be located and recognized in different views before we study them in greater detail. The calvaria includes the frontal bone, located anteriorly, the occipital bone, which is posterior and inferior, and the right and left parietal bones, which connect the frontal and occipital bones, extending superiorly and laterally on the cranium. The other 4 cranial bones composing the floor include the ethmoid bone, which is mostly internal. It's not labeled on these images, but it can barely be seen in the inner inferior quadrant of the orbits in pink. The sphenoid bone articulates with the inferior portion of the frontal bone, and the right and left temporal bones make up the lower lateral portions of the cranium. The bones of the cranial vault are composed of 2 plates of compact tissue separated by an inner layer of spongy tissue called diploe. The outer plate or table is thicker than the inner table, and the thickness of the layer of spongy tissue varies. Except for the mandible, the bones of the cranium and face are joined by fibrous joints called sutures. The 4 sutures are the coronal suture, which joins frontal and parietal bones, the sagittal suture, which is not seen on this view, but lies on the top of the head between 2 parietal bones, the squamosal suture lies between temporal bones and parietal bones, and the lambdoidal suture is seen between occipital and parietal bones. The lambda is the junction between the lambdoidal suture and the sagittal sutures, while the bregma joins the coronal and sagittal sutures. On the lateral aspect of the skull, the junction of the parietal bone, the squamous suture, and the greater wing of the sphenoid is the pterion, which overlies the middle meningeal artery. At the junction of the occipital bone, parietal bone, and mastoid portion of the temporal bone is the asterion. In newborn infants, the bones of the cranium are thin and not fully developed. They present 6 areas of incomplete ossification called fontanelles. 2 fontanelles are located in the mid-sagittal plane at the superior and posterior angles of the parietal bones. The anterior fontanelle is located at the junction of the 2 parietal bones, and 1 fontanelle at the bregma. Posteriorly, and in the MSP, is the posterior fontanelle, located at the lambda in adults. 2 fontanelles are also on each side of the inferior angles of the parietal bones. Each sphenoidal fontanelle is found at the site of the pterion. The mastoid fontanelles are found at the asteria. The posterior and sphenoidal fontanelles normally close in the 1st and 3rd months after birth, and the anterior and mastoid fontanelles close during the 2nd year of life. The cranium develops rapidly in size and density during the first 5 or 6 years, and by age 12, adult size and density are usually achieved. Internally, divided into 3 regions, the anterior cranial fossa houses frontal lobes of the cerebrum. It extends from the anterior frontal bone to the lesser wings of the sphenoid and is associated mainly with frontal lobes of the cerebrum. The middle cranial fossa accommodates the temporal lobes and extends from the lesser wings of the sphenoid to apices of the petrous ridges. The posterior cranial fossa is a deep depression posterior to the petrous ridges, which protects the cerebellum, pons, and the medulla oblongata. When considering skull morphology, the typical skull is mesocephalic, where the petrous pyramids project anteriorly and medially at 47-degree angles from mid-sagittal plane. The brachycephalic skull depicts the petrous pyramids projecting anteriorly and medially at 54-degree angle from the MSP, causing it to be shorter from front to back and broader from side to side, as well as shallow from vertex to base. The dolichocephalic skull's petrous pyramids project anteriorly and medially at 40-degree angles from the MSP. This lengthens it from front to back, narrows it from side to side, and causes it to extend deep from the vertex to base. Asymmetry of the outer features should be noted while positioning. For example, the nose may not always be at midline.